And finally, the obvious issue of leadership, of distributed leadership, and about investing in leadership capacity development initiatives. And I think a key leadership competency is to role model the type of healthy behavior that we would wish to see in our healthcare providers. Not only because I want to practice what I preach, but also because there's a role to motivate and inspire others, to make it easier for people to look after their health themselves.
Thanks, Susan. So just to round off, we wanted to ask for input from an education training perspective. So Oliver and Dumi, if you want to come forward to share with us your perspectives as students.
Good afternoon, everyone. So Dumi and I will be speaking about our experiences as students, and as well as to what extent we feel that the training that we receive here at school prepares us for the challenges in the real world. In theory, we do get training. At the university, we have two multi-professional courses, becoming a health professional and becoming a professional. They form part of the core curriculum, and also they're compulsory to everyone. So from these courses, we do get some training because we cover a lot of things, a lot of challenges that are faced. We cover how to deal with finding yourself in a situation whereby you are with a racist patient, or you have a patient who won't want to work with you, or you're experiencing burnout, or you're experiencing stress. So in that regard, yes, we do receive training. However, the reality is that we live in a very unequal society, and as a woman, my experiences might be different to what Dumi is experiencing. And in that regard, I don't feel that we get enough training, because I was actually sitting here and thinking about what the previous speakers were talking about, how they still need to get home, how they still need to cook, how they have to look after their families. I don't think that Dumi could relate as much to that. So now the question is, should Dumi and I be receiving the same training? Is it fair that I will receive training that Dumi will be receiving, but I'm experiencing different or maybe more challenges than Dumi?
Good evening, everyone. As mentioned, I mean, there's this huge disparity between the haves and the have-nots, and the private and the public system. On top of the theory that we receive, I mean, we are actually given an opportunity to go out into the various communities and interact with patients at various facilities. It gives us a practical view of the theory, and sort of shows us our gaps and what we still need to learn, and what we do know and what we have done right. But then, on a personal note, my experience of the health system was very positive, and I was living in this bubble before I came here. But then, I mean, seeing all of that and seeing the gaps sort of opened my mind up. So I had to open up my mind and actually see that people experience the health system in different ways. For instance, if I had a cough, I just call my family doctor and I can go there and it's all done. But then for someone else, they actually put their health second to work and other challenges, and that is something that we actually need to take note of. As a student, it's really, really something else to actually see it in a practical manner, and I still feel that, personally actually, let me rather say, I feel that we actually do receive enough training. But then, however, there are challenges that we won't be able to be trained on, because there's different settings and there's different systems, and truth be told is that when we graduate, we won't all be working in the same place. So the challenges that we will receive are different. But then, however, with these challenges, we'll just have to learn through experience.
Just to add to what Dumi said, I did mention that in a certain regard, yes, we do get training. and to me seems to think that yes, we do get adequate training. However, even though I have attended all my BP lectures, all my becoming a health professional lectures, there are things that I feel it's still not covered, because I remember about 6 weeks back, a friend of mine came to me crying. She's crying because it was our first day of block, and she's crying because her patient wouldn't see her. She had a black woman that was her patient. She's also black, my friend's also black, and the woman refused. She refused to get training, or she refused to get treatment from her, simply because she didn't think she was good enough based on her being black. She literally pointed to our other classmate, who happens to be white. She said, no, I don't want you, I want her. So who can prepare you for that? And then at the end of the day, we have no one to go back to say, listen, today this is what happened. And I feel that those are things that we need to be trained for, because it plays it has a really big role. Because the next day, she might not be wanting to see patients because she's still thinking about what happened the previous day. So we do, although we are getting enough training, a lot still needs to be done.
Thanks very much. We might actually ask you whether to come teach on the gender and health course. So we had planned to actually have a discussion amongst the panel, but we ran a bit late. So what I'd like to ask also is just gather your thoughts about the questions you want to ask, and I'm just going to ask the panel if anybody wants to respond to anything anyone else said at this point, while the audience gathers the questions. Anybody want to make any comments about that?
Just perhaps the City of Cape Town implemented a mentorship program for staff. And it was for various reasons that some of the panelists mentioned about, how do you cope with these issues which confront you, which could be of a very diverse nature. And it required all staff to attend, and we found that in some instances, staff started attending and found value, and then afterwards they said, we need to go back to that stressful situation. It's a challenge, but there is mentorship programs. It's available. We have coaching one-on-one to our facility managers and staff, and it's all to assist so that we can improve our coping mechanisms. And it would be quite useful for research to come and see, is it making an impact on us, or are we responding better, are we coping more meaningfully?
Is there any more comments, questions from the floor? Jennifer?
Yeah, I'll shout. Thanks very much. It's really been a very interesting discussion. And I look at the panel and I see most of the female. A lot of the issues raised to me have to do with gender. And I wanted to hear from Sylvia and maybe Susan as well, from the work you do in Vigil's play. Are you addressing those issues, and if so, how? Because I'm sure they will come out.
Can I make a session to take a few questions? So, Mohammed, you want to do comments?
Do you mind repeating the question?
It was the observation that gender really seemed to be important, and so the question was to Dial's project in Mitchell's Plain, what have they learned about gender in their work?
Thank you very much for the presentations. What struck me about most of the presentations is the focus on the individual healthcare worker. And I want us to just step back a bit and talk about the structural aspects of health and safety of healthcare workers. So, what about the physical environment? What about the work organization that impacts on people's ability to work? I think we've heard about the psychosocial aspects in terms of that. But I think if we want to deal with the health of healthcare workers, we can't expect healthcare workers to only take on that responsibility. The part about wellness and looking after yourself and the health promotive behaviors, yes, those are, all of us subscribe to our individual choices, and we certainly need to encourage and move people in that direction. But when you talk about the poor health and safety issues, the fact that the increasing number of healthcare workers with TB, the increasing absenteeism because of workplace stress. Then you have to talk about the work organization and the work context and what is being done at that level in terms of intervening that prevents, as Tracy spoke about, people from developing these problems.
I'm van Delft and I represent a patient advocacy group called TB Proof. And just to link on to what Jibo was saying, there hasn't been a lot said about safety at the working environment. Most colleagues I know have been on ALBs because of needle stick injuries. Many of my colleagues have suffered trauma as a result of unsafe environments, assault, and even some of them sadly sexual assault. And then of course tuberculosis. Healthcare workers have a 3 times greater risk of contracting TB. And there are strains of resistant tuberculosis that carry mortality rates of 30% in healthcare workers. And then I'd specifically like to some comments on 2 very vulnerable populations. The first is healthcare workers living with HIV, because you never hear anything about them, but it's estimated that 15 or even 20% of them live with HIV, and particularly in the context of tuberculosis exposure, that's a massive risk. And then trainees or students, because they are frequently expected to work in the same environment, similar hours, but no compensation and no legislation to protect them in case something goes wrong. And we've seen that with students who have suffered morbidity and even mortality, and it's an end to their career or even life. And I'd like more comments on that, please. Thank you.
Okay, one more at the moment.
So it's regenerated from health and rehab. And when I look at the panel, I see that stuff around disability and rehab is completely left out. And that nurses are expected to pick up a lot of that as well without proper workforce planning in terms of getting enough posts for that. Linked to that is that there's not I think as health professionals, we're not trained to be confident and willing to transfer our skills to community workers, whether they're home-based carers, rehab care workers, community health workers, whoever. I mean, Marion could speak around the sign language interpreters, but there's also a lot of focus on burden of disease rather than what Karen Amanis in the Department of Health has been pushing in terms of burden of care, and that we have to look at families and the burdens that they carry in terms of particularly vulnerable groups, like disabled people, and especially those who bear the stigma of mental illness. And I'm glad Sue is here, because I think what Department of Health needs to start doing is to disaggregate data of the health information systems, of health systems research and health economics of disability. Because we're not doing that, and we're not even bringing the gender differences in there, and that's also for mothers of disabled children.
Okay, I'm going to hold any more questions for the moment, because otherwise you'll forget what you wanted to say. So please be brief. You don't have to say anything if you don't want to say. I'm just going to ask you if you want to make
As Labour, obviously, our first focus was on the illnesses that you are presented with as you enter the institution, which has obviously been mentioned by the speaker at the back. But the concern, obviously, is what processes, and we've said that the concern for us as Labour as well is the fact that policy and processes to deal with what you are confronted with is not in place at the moment. So we critically all have to look at that, and especially also with regards to assault, like we've said, because we are confronted with that more and more now. Those are all the areas actually, because we don't have specific policies. We do have, but I mean, it's not really, you know, looking at the worker and what your concerns are.
Just maybe, Prof. Jiwe, I think I agree with you about the physical environment. I was thinking about break times. There isn't any place for us to have a break during the day. If you walk into I see Dr. Kluti here, our emergency unit and our psych units, there isn't adequate ventilation. So the gentleman with the TB question, that's also quite relevant. So there are no, well, there are, but the environmental issues are not being addressed adequately. So yeah, I think that should be.
Gender real issues. In the city of Cape Town, we have a gender forum, corporate, and we have, in City Health, we have a gender forum, and I head that forum. And we get many issues which is gender related. I think many women see things so differently. There was a time in the city we had to fight for them to put sanitary bins in facilities. So imagine, if you're a woman, how do you work without a sanitary bin? Men, of course, they can. So it's these issues that we as women have to talk up, get up and talk about it, and, let it be known. I'm in a very difficult situation where sometimes gender issues is reported and it is about line management, and it's that challenge. But sexual harassment is an issue which is so subtle in the workplace and plays itself out everywhere where there's power. And it's sometimes also not spoken about. It's real issues, and I don't think that we're giving it the attention that we should. In terms of health and safety, in the city of Cape Town, we have our local health and safety committees within the workplace, and at the district level, we're forced by law to have it, and we do have it. And it's a very empowering forum. When people talk about the needle prick injuries and how it happened, a nurse, a cleaner walks past, and the nurse just decanted it, and pricked them. And it's real big issues. But and Karen is standing at that. She's done a lot of work around TB and preventing TB, the spread of it. So we have a tool which we do once a year. And we look at the risk factors, we looked at ventilation. We've looked at all our facilities to look at infection control. Where do we put our TB patients? Where should they exit? Where should they enter? Who should be dealing with them? So if you're immune compromised, please tell us. If you don't, we can't help you. But all our staff, they wear respirators. And all our patients, when they walk into clinic, they have masks on. Initially, it was a real challenge because and then we said, because initially it was just for TB patients, and then other patients were saying, so why do they have masks on? So we had to make it for everybody. So we've tried to do quite a bit, and Karen there is really the expert around TB in the workplace. But safety is a real issue. I think it affects more private healthcare workers out there. We get robbed in our clinics, our cars get robbed. You come out and your car might not be there today. But it's also, we've had instances where a staff member was almost raped by a psychiatric client in a private healthcare facility. So we've tried to negate these issues, and it's challenging in terms of the budget. The issue that we have now